Are there any pets who are not good candidates for chemotherapy?
I need to think about that one. So the patients that are not good candidates for chemotherapy would be pets that may be very ill to begin with. And so I'm going to use the example of lymphoma. So you may be very ill, but if it's because of lymphoma, then you're likely to get much better once you start chemotherapy. So that's a different scenario. So in that scenario, I would say, well, you may be very ill, but because it's due to your cancer, we should still go ahead and treat it. And chances are, if you respond, you're going to feel a lot better. But if you have other concurrent, what we call comorbidities, so other diseases or other illnesses, then you might not be a good candidate. So for example, if you have a heart disease, there's certainly, depending on what the heart disease is, but you certainly should think very carefully before taking a drug specifically called doxorubicin. Nowadays, we really don't use cisplatin anymore, but if we thought that that was the best drug and you had kidney disease, we would recommend against it. So there may be some specific instances where we say chemotherapy is not a good idea, depending on what the chemo agent is and what the concurrent health issue is. But by and large, most dogs are going to tolerate chemotherapy very well. So on the topic of chemotherapy, about 5% of dogs are going to have very severe side effects. The flip side is that 95% have minimal to mild side effects. If the dog happens to be in the 5%, nobody's going to push to continue all of the treatments. We're going to, as a matter of fact, we'll be the first ones to say this is not for you. So what are the strategies? We can stop altogether. We might be able to offer another drug, and just because you were very sick on one drug does not mean you're going to be very sick on the other drug. We can do what we call a dose reduction. So there are different strategies that we can use if the side effects were too severe. We may still be able to continue chemotherapy whether we do a dose reduction or we change the type of drug. But certainly a client has always the right to say this is not for us and just stop the treatment altogether.